Hi, everybody. Welcome to week 5. Congratulations. We're almost a third of the way through the course. We're getting there. All right, this week we've got use assessment and evaluation strategies. This is a meaty, big old topic, and there's a lot to discuss. I want to start out by just talking a little bit about tying things together within a nursing curriculum. And this can be within a clinical practicum curriculum, this can be within a patient education curriculum, or an academic curriculum, okay? And the thing that we have to remember is that we have to start out knowing where we're going, okay? So you've got the broad outcomes that you want all of your graduates to be able to accomplish. You know, nursing school graduates, hospital orientation graduates, patient graduates, whatever those final outcomes are. So they're kind of broad, right? And then you narrow that down, and so you've got the broad overall, and then you narrow that down to what you want to accomplish in each course or each teaching session, or however you want to do that. I'm going to explain this more in terms of an academia course, but it can apply. Okay, so I've got to know my overall arching goals, right? Because every single course feeds into those. I've got to know where my course, oh, my lighting is really weird today, sorry. I've got to know where my course fits in with the overall curriculum, what comes before mine, what comes after mine, what can I expect students to bring in with knowledge, what do I have to prepare them for going out of my course, okay? Then we've got to have either weekly or unit or class objectives, depending on how you're teaching it, okay? If you look in the syllabus for this course, we have objectives for every week that we're supposed to be accomplishing, okay? So when I look at what I'm going to teach, and then my assessment and evaluation, it all has to tie back to those objectives. So I shouldn't be going off on tons of tangents in my teaching that aren't related to those objectives. And the things that I evaluate have to tie back to those objectives. So the student shouldn't be surprised at the questions you're asking on an exam or for a paper, because they have to do with the content, because the content was based on the objectives, and the evaluation questions will be based on the objectives. So everything needs to tie together. I've seen some new instructors, teach the things that they thought were important. Let's say you've got care of a respiratory patient. And then they go and they put together a test, and they pull out minute facts from the reading or different things like that, and they just pull out things that they say, oh, this is important, I should probably include those. It all has to tie back to those objectives. I don't know if you remember when you built your own course, you first set up objectives, and your teaching had to tie to the objectives, and how you evaluated it had to tie to the objectives. I think Seminar 1, Seminar 2 in there. So anyway, it all has to tie together. And actually, if you go overboard on a test and start evaluating things that aren't tied to the objectives, you can actually leave yourself open for a grievance, because you're not following that contract, per se, of what you said you were going to do for your course, which is the syllabus. Okay, so you will actually, I'm assuming all of you will be doing some sort of evaluation or assessment in your practicums. And for this course itself, you're going to be creating in week 11 the multiple choice test that you're going to be giving to your peers. So I'm attaching a couple things to this video. One is a nice slide presentation done by another individual talking about improving test evaluation. And it goes through and talks a little bit about objectives, but then it also talks about creating test questions and things like that. So I think that would be interesting. And then there's an article about competency outcomes and performance assessment model, the COPA model. And that is really trying to drill down and making our objectives really match what students are going to need to do in the practice setting, or what our patients are going to need to do when they go home, or whatever it is, whoever it is that you're teaching. So I've included those two articles. And so go ahead and take a look at those and see what you think. And I'm really looking forward to seeing what you answer for your DQ. Remember to obviously read the section here, but remember to look at that first page of the chapter dealing with assessment and evaluation strategies, because it lists the components, and make sure you're addressing those in your DQs. Okay, so with that, I think I'm gonna wrap it up, and I'll see you in the main forum.